Repair atrial septal defect, secundum, with cardiopulmonary bypass, with or without patch. The right atrium is opened and the size and location of the arterial septal defect are assessed. If it is small enough or if the atrial septal tissue is sufficiently redundant, the defect is closed primarily with suture. If not, a patch of pericardium or dacron is sewn to the edge of the defect to close it. Repair of atrial septal defect and ventricular septal defect, with direct or patch closure. The right atrium is opened. All dead heart muscles is cut out and the ventricular septal defect is closed with a patch of dacron or pericardium. The hole in the atrium and ventricle is closed. Complete atrioventricular canal defect, CAVC. Complete atrioventricular canal, CAVC, is a severe congenital heart disease in which there is a large hole in the tissue, the septum, that separates the left and right sides of the heart. The hole is in the center of the heart, where the upper chambers, the atria, and the lower chambers, the ventricles, meet. Repair of incomplete or partial atrioventricular canal, ostium primum atrial septal defect, with or without atrioventricular valve repair. Repair of intermediate or transitional atrioventricular canal, with or without atrioventricular valve repair. Repair of complete atrioventricular canal, with or without prosthetic valve. The right atrium is opened. A division in the anterior leaflet of the mitral valve is closed with the interrupted sutures. The ventricular septal defect patch is placed. The arterial septal defect is closed with a patch of dacron or pericardium. The right atrium is closed and cardiopulmonary bypass discontinued after heart function is restored.